Hello friends, myself Dr. Yogesh. Mainly we are dealing here with the infertility. There are many factors in infertility. We are continuously helping patients for the awareness, for the treatment, and they are having successful pregnancy also. So last time a male factor infertility we have spoken about the male factor infertility. Second, other factor in that, what is IUI? So we have seen what is PCO, we have seen what is male factor infertility. Most of the time patients are they are having confusion regarding IUI injections, IUI treatment, and when it is indicated. It's an intrauterine insemination. See, when a physiological process happens, when a natural pregnancy occurs, how it occurs, I have explained the physiological process also in another video. So when it occurs, a sample comes to vaginal part, and then only sperm migrates because sperm has a motility. When motility is good, when count is good, all sperms will not reach up to the uterine cavity. Only some sperms will be there, and out of that 100 to 200 sperm will reach up to the oocyte. See, actual count in the semen, in a 1 ml semen, more than 15 million sperms is the normal count. That means out of 15 million, from 1 ml semen, only 100 to 200 reaches up to the oocyte. So you think about that, why it is like that. Obviously this distance is there, and these sperms reaches to the uterine cavity and then up to the oocyte. While going to that place, some sperms get lysed, some sperm get killed. Okay, so it's a natural, it's like a survival of the fittest. The sperm which has the best motility, best parameters, best morphology will reach up to oocyte. But what if it is not occurring? What if pregnancy is not occurring? What if infertility is there? So we treat it with a medicine like a follicular stimulation and having plant relation at home. So it's a treatment modality for 1 or 2 years. If you are trying since last 4 to 6 months and still pregnancy is not there, then definitely you have to update your treatment or increase your modality of treatment, and that's IUI. So IUI is intrauterine insemination. It's done at the perfect time when follicle is ruptured. So treatment is given from day 2 of the cycle to the female partner, and then they start the treatment with some types of medicine. So that causes folliculogenesis, some injections that improve the quality of oocyte and the follicle. Right time injection for the rupture of that follicle is given, that's injection SCG, 5,000, 10,000, doesn't matter those. But after that injection, 36 to 40 hours, after 36 to 40 hours of that injection, IUI is performed. Before IUI, follicle is ruptured or not, it is checked. Whether it is ruptured or it is not ruptured doesn't matter. You can do IUI after 36 to 48 hours. 36 to 40 hours, it's a single time IUI. In some patients, double IUI is also done, where 2 times IUI done, first after 24 hours and second after 36 to 40 hours. So IUI is very simple procedure. We ask husband to give sample. Sample is processed with the centrifugation and specific technique, and processed sample is used for IUI purpose. With a small IUI catheter, semen sample is placed inside the cavity. 5 to 10 minutes rest is advised. After that, patient can perform their routine daily activities. So remember one thing, IUI is very simple treatment. It's having a success rate of 10 to 15%. That depends upon which kind of injections they are having. So when you are using only tablets, definitely success rate will be low. When you are using tablets for injections, then success rate will be little bit high. So total success rate, if you see a cumulative pregnancy rate in the first 3 IUIs, success rate will be 30, maximum 15 to 30%. But after that, success rate will be low. So remember one thing, IUI, whenever you are doing IUI, it's not a very big deal, but go through that. Many patients are there, they are having successful pregnancy after IUI, but we have to go through it. And many patients are there, they are not having success, but we have to follow a step-by-step treatment approach. In IUI, most of the couple, they are worried about what to do after IUI. whether to have a complete bed rest, whether they can perform daily activities. So I'll say there is no restriction to their daily activities. There is no diet restriction, no extra or heavy medicines are given. It's a natural pregnancy. They are advised to have a alternate day intercourse also. So whenever you are planning for a pregnancy, go through IUI because it has a little bit higher pregnancy rate or successful conception rate compared to natural planned relation. So IUI will cost around 2,500 to 3,000. That depends upon city to city, but it's not a very high treatment. So treatment month wise cost will go up to 8 to 9,000, including all types of the medicine. So when you are trying since last 1 or 2 years, when you are taking treatment with the medicine and trying at home and still not getting pregnancy, then try IUI. You can try maximum 6 IUI, but successful pregnancy rate or conception rate will be high in the first 3 IUI. So after IUI, then next comes the IVF. You can have a step-by-step treatment approach. So this is about the IUI. We have seen how it is done, how it is processed, how it is followed after IUI. Definitely, if you have some queries, you can ask me at any time. Thank you. No problem.